My name is Shana Tetrault. I have a PhD in molecular and cellular biology. I work at Quanterix as the director of product marketing. Yes, so I think it's important when a study like the JAMA study on subjective cognitive decline comes out to be able to translate it in such a way that it makes sense for a general audience as well as clinicians, right? And the significance of this study was interesting in the sense that they used subjective markers. So they used the patient's own findings and understanding of their day-to-day life to determine, would this person be good for additional testing for Alzheimer's markers? And what's interesting here is, on your yearly physicals, you go in, you often have blood draws, and it's quite routine to have these blood draws. And now, given that there's the opportunity to test for certain biomarkers of Alzheimer's in the blood, it just makes sense to, if someone is self-reporting or the person that they're coming in with is self-reporting some changes in behavior over the year, to flag those folks as those that could be good candidates for plasma biomarker testing for certain markers of Alzheimer's disease earlier than you would traditionally. Yes, so technologies like Simoa are critical in the sense that the earlier you catch a disease, the better you have an opportunity for intervention and remediation, right? And so technologies like Simoa, which provide ultrasensitive detection, allow you to measure disease onset earlier than you traditionally would have, right? So the ability to measure at the initial increase of a particular biomarker is ideal and is a best fit, especially in a clinician's office to determine, from last year's exam to this one, the change that they're indicating, does it mark up, does it measure up in the blood as well? And if you can see an early change, a very early change, the administration of drug intervention or therapeutics is ideal, right? You can slow that cognitive decline. You can allow the person to have a better quality of life for a longer period of time than they would if you waited for true cognitive symptoms that are delaying their function to set in at the age of 65 or older when these conditions, these neurodegenerative conditions are usually diagnosed.